name is Catherine McClure, and I'm here to validate for Professor Hayes, Class 602, on IV piggyback. So to begin, I would obtain my physician's orders, I would wash my hands, gather my equipment. I would need to introduce myself to the patient and identify them, asking them to state their name and date of birth, and comparing it to their ID bracelet. I would then provide privacy and explain the procedure. So to begin, I would compare my medication to the physician's orders and the record. I would then obtain my IV piggyback solution, checking the expiration date on the medication and comparing the medication to the MAR. Next, I would need to assess the patient's IV site in their arm. I need to check for signs of infection, infiltration, and I need to be looking for signs of redness, swelling, looking for patency in the line, and I would also ask the patient if they're having any pain in or around the IV site. Next, I would be assessing my primary IV and the IV tubing, checking for patency in the line and the rate of infusion that was prescribed by the physician. But before I can continue, I have to calculate my drip factor for the IV piggyback medication. And this medication is 20 drips per minute, which is 1 drop every 3 seconds. So now that I have my drip factor, I have assessed my patient and the primary IV. I would wash my hands and open my IV piggyback tubing. So I have my IV piggyback tubing, and I would need to clamp the tubing so it's completely closed. I'm going to take my medication and open the cap.
And now that the sterile field is set up,
along with my spike cap. And I'm going to spike the medication while filling the drip chamber to about halfway. Next, I need to prime the IV tubing. So I'm going to remove my cap
and now I'm going to down the sterile.
and open my IV tubing and clamping it while keeping it above waist at all times to maintain sterility. So I have my IV piggyback tubing clamped. I would then move to place my IV sticker on the IV tubing, specifying my name, the date, and the time that it was changed, along with the date that it needs to be changed again. So now, before I continue, I'm going to open my alcohol swab. And I need to swab my primary port for a good 10 seconds, just to kill all bacteria.
I'm ready to clean the patient's central line first. So I'm going to grab this out of the sterile field. I'm going to break it. And I'm going to come over and clean the site.
So now that my IV tubing has been sterilized with the alcohol swab, I have my IV piggyback tubing completely clamped. So I'm going to insert the IV tubing into the primary tubing. I'm going to grab my extension and lower my primary. Next, I'm going to completely unclamp my piggyback tubing and control the piggyback medication with the primary IV tubing clamp. So this medication requires 1 drip every 3 seconds. So I'm going to go ahead and set up my drip factor.
And I'm going to make sure that the dressing is in the
So I have my IV piggyback solution set to the drip factor of 1 drop every 3 seconds, and I'm going to check it. 1, 2, 3, drop, 1, 2, 3, drop. So now that the IV has been set to the proper drip factor, I would allow the solution to completely infuse into the patient. I would then, lower the bed, wash my hands, allowing the IV piggyback solution time to infuse. After it's completely infused, I would come back in, wash my hands. I would completely clamp the IV piggyback tubing. I would remove the old bag and raise the primary IV solution while setting the drip factor to the prescribed drips per minute. I would then document all of my observations throughout the procedure along with my I's and O's and make notes on the medication record. I would also reassess my patient for comfort and how they tolerated the medication. Before I leave, I would need to lower the bed all the way down and give the patient their call bell. I would need to wash my hands, and that's all. Thank you.